listeners, since dili kay ta mag-meet for lectures, I decided to experiment on kanang recording my lectures na lang instead. So, ang topic for this video is, ang tawag is FRICHMOND. So, sa Pedia, we usually have an acronym called FRICHMOND. It stands for Fluids, Respirationn, Infection, Cardio, Hematologic, Metabolic, Output, Neurologic, and Diet. So, this is what we usually use in terms of kanang forming our assessment. It can help us in our diagnosis or making orders, as well as ito rin yung ginagamit namin for endorsement. For example, if resident to resident, you want to update your co-resident about the patient status. So, FRICHMOND sa damo ang ginagamit. So, for example, gamit tag index case. So, this is a 3-year-old patient with severe PCAP. Ang chief complaint niya is cough and difficulty breathing. The patient is a 3-year-old child who presents with a 5-day history of cough, rapid breathing, and difficulty in breathing. So the symptoms have been progressively worsening, and the child's parents are concerned about their child's breathing difficulties. The cough initially started as mild and dry but has now become productive with yellowish-green sputum. The child's parents noticed an increase in the child's respiratory rate and chest contractions. They report that the child has been experiencing fever and temperatures around 38.3, and the child also had poor appetite, decreased activity, and increased fatigue. Ang past medical history, family history, and social history are apparently kanang unremarkable. And sa physical examination, the child appears ill with increased work of breathing. The child is lying in a semi-fowler's position, leaning forward with their hands on their knees and demonstrating respiratory distress. And the child is alert but appears tired. The vital sign shows the following. So, febrile siya at 39, tachycardic at 130 beats per minute, with an RR of 40 breaths per minute. Blood pressure is at 100/60, and hypoxic siya at 92% on room air. Ang salient na physical examination shows increased use of accessory muscles, nasal flaring, and chest retractions. Upon auscultation, there was diminished breath sounds on the left side and crackles and bronchial breath sounds over the right lower lung field. So, for this case, ibutang na lang natin na the physical examination of the other organ systems were unremarkable. So, i-try na to o gamit ang FRICHMOND in terms of kanang placing it sa side notes. So, for example, kanang sa atong doctor's order, naman ay usually we use the SOAP. So, pwede sa ta mo gamit og FRICHMOND. For example, sa fluids, we can mention the hydration status of our patient. For example, we can write non-sunken eyeballs, moist mucosa, and good skin turgor. Ang sa respiration, you can also place sa side notes na tachypnic and respiratory distress. Ang imong auscultatory findings of decreased breath sounds, crackles on the right lower lung field, and naa siya episodes of desaturation at 92%. For the infection, meaning any signs of infection, you can also note na febrile ang patient at 39. And then cardio-wise, you can write the heart rate of the patient, or you can place it here, tachycardic. Hematologic, meaning if there are signs of kanang pallor, or we have patients na ay active na bleeding. So, for this patient, wala may pallor. So, no pallor, no active bleeding. And then, for metabolic, there was no mention of any kanang fluid losses or any other kanang volume losses for that matter. So, ibutang sa nato diri no active losses. For the output, we can place no vomiting and no diarrhea. as kanang per examination nato og history. But we can also write here the since output siya, so urinary output of 2 cc per kilogram per hour. Neurologic wise, we can place here tired ang patient, tired looking, decreased activity, and also sa neurologic, appeal sad ang any episodes of seizure. So for this particular patient, wala siya, no seizures. And then, we can place here sa diet, based on our history and PE, na siya poor appetite. So we can also use FRICHMOND in generating our kanabitang anticipatory na problems we could kanang encounter with our patient. So for example, in terms of FRICHMOND, we can start with fluid. So our patient is at risk for dehydration, secondary sa iyahang takip niya, and also sa fever. And then respiratory wise, we could place here na our patient is in respiratory distress. So that's also a problem na we should really address. And then infection, we know based from our previous na data na the patient has active infection, and we can deduce na the infection's source is pulmonary. And then for the cardiac wise or cardiologic na problem, our patient is tachycardic, although within normal ang blood pressure. However, tachycardia is an initial sign ng kanabitang impending na shock. So our patient is in kanang compensatory na state, so hence the tachycardia. And then hematologic, we can anticipate that there would be laboratory derangements. So secondary sa yung infection, we might consider sepsis for this matter. And then the same as metabolic, we could also expect laboratory derangements like electrolytes, as well as ang metabolic, we could include here ang arterial blood gases, so we can check the blood pH of our patient. And then output, as mentioned, ang ginabutang namo diri is the bowel movement and the urinary output. So for this particular patient, we are concerned of the urinary output because starting pa lang sa infection, it would lead to sepsis, it would lead to shock, and then the next of the shock would be organ damage, particularly sa iyahang kanabitang urinary na system. Neurologic wise, we know from the previous data that our patient has decreasing sensorium due to the patient's fatigue, because of the respiratory distress. Hypoxic pod ang patient, so it would lead to kanang decreased oxygen supply, and as well as kanang the overall state na the patient has an ongoing infection, so decreased iyang sensorium. For the diet, usually ang among ginabutang here is either nutrition or how the patient is going to provide yung sa intake niya. For example, if ang method is in NGT or naka-colostomy ba ang patient, ingana, or kanang naka gastric tube. So dili na mo ginabutang sa diet. So also we can also note here na prone ato ang patient for aspiration because of the respiratory distress, as well as poor nutrition, secondary sa iyang poor na appetite, kay kuan man because of the ill state, so wala siya kaayoy kanang intake, and then naapag yun siya increase na metabolic demand. So all the more na kailangan niya mo kuan yun poor yun iyang nutrition at the moment. So muni siya ang kanang example of how we can use the acronym na FRICHMOND. For the order, we can also use FRICHMOND as a way to kanabitang there's a decreased chance na you would have kanang items missed sa imuhang order if pasunod pod ang imuhang management. For example, if sa fluid, since on the past na slide there was risk for dehydration, so you could also place here mura siyang side notes na lang po na you would put the patient on D5LR at mild rate, and then on the respiratory side of things, since our patient is in respiratory distress, so sa order sa nimo, sa upon writing your order, you could start nebulization like salbuipra, and then you could hook the patient to a kanang continuous na positive airway pressure, and you could also order next is yung standby na intubation in case of kanabitang progressive na respiratory distress. For the infection, you could order for inflammatory markers. You could also get blood cultures for the patient, and then you could note or i-remind mo yourself to start the patient on ampicillin sulbactam at 200 mkd and clindamycin at 40 mkd. And then cardiologic wise, since the patient is tachycardic, so you could hook the patient to a pulse oximeter or even better to a cardiac monitor. And then hematologic, you could order for CBC, blood typing, and then metabolic, since our patient is prone to dehydration and ang kanang infectious na state sa patient, so mga laboratory derangement, so you could order for electrolytes, and as mentioned before, arterial blood gas, so that you can check if the patient is kanang okay ang buffer system. And then for the output, you could place a doctor's order monitoring sa iyang urine output. And then for neurologic, you could also write sa imong doctor's order, watch out for decreasing sensorium and or seizure episodes, since the patient has kanang febrile episode, or sometimes if we have kanabitang persistent na hypoxia, our patient could go into seizure as well. Ang sa diet, you could also place the patient on NPO since our patient is in respiratory distress. And katong mention nato sa previous slide na we have considered the patient prone to aspiration. And then since NPO ang ato ang patient, you could also write sa imong order na CBG monitoring or glucose monitoring while on NPO, because since wala tay intake, you could put the patient on a hypoglycemic state since kanang ongoing siya infection and wala siya kaon. So mo to yung i-monitor sa nimo imong CBG. We could also use the FRICHMOND as mentioned katong during endorsement. For example, you're the admitting resident or you're the admitting na physician, and then padulong na sa ward ang patient and you want to endorse the patient or outgoing ka na, you could also use the acronym na FRICHMOND so that wala sad may ma-miss in kanabitang endorsing the data or the events or the management of your patient. So for example, FRICHMOND. So pwede nimo ingnon sa imong resident na, I have already hooked the patient on D5LR at mild rate, already started on nebulization with salbuipra. So you can mention how many doses, and then na-hook na nimo ang patient to CPAP, and then all your healthcare staff are aware that the patient is on standby intubation. And then what we usually say is infectious wise, so inflammatory markers and blood cultures are already taken and then loaded with ampicillin and clinda. Cardiologic wise, the patient is already attached to a cardiac monitor with a heart rate of 110 beats per minute. And then hematologic wise, CBC, and then blood type taken with the following result. So hemoglobin of 120, hematocrit of 0.36, tapos increased na WBC of 17, with neutrophil predominance of 99, monocytes of 40, lymphocytes of 10, and blood type of O+. And then metabolic, so the following are the electrolyte results: sodium of 138, hypocalcemia of 3 with so kibali ongoing correction ka na. So you can also say to your incoming na resident na ongoing correction, magnesium of 2.2, chloride of 106, and then you already got the kanang baseline na ABG, which showed the result of compensated respiratory acidosis with adequate oxygenation. Sibutang na lang natong muna yung ABG. And then output, monitoring of urine output was already done with 3 cc per kilogram per hour. And then neurologic wise, the patient is on GCS 13, E4, V4, M5 with no seizure episode. And diet, the patient is on NPO at the moment with CBG monitoring with latest CBG, so usually trend man na siya. So kani siya baseline na CBG of 120 milligrams per DL. So if you endorse your patient like this, especially kanang us nagikan og kanang district and then ibalhin nato og to a higher institution, there would be less na information that they would ask from us. Mas efficient ang atong pagbalhin sa patient. So it would save us time, and it would lead to kanang bitong a better na transfer of the patient. Mas less ang problem if kanang we endorse as comprehensive as kanang we could be. So muna siya, FRICHMOND. Thank you.